Thank you for the opportunity to come and present our survey to you today. I'm Okesene-Gafa, one of the obstetricians, gynecologists here at Manukau Hospital. I'm also a senior lecturer at Department of ONG part-time, and I'm also part-time PhD. And I'm of Pacific ethnicity, Niue and Samoan Cook Island. Oops, sorry. Just a background about my talk. Sorry, I meant to. The survey that we did here was called Knowledge and Beliefs about Nutrition and Physical Activity During Pregnancy in Women here in South Auckland, Counties Manukau. Just an outline of my talk today, and that's been published at the ANZJOG last year. And for those who are very keen readers, you can read at the reference down below. In 2012, we had an external review of maternity care here in Counties Manukau, and that was commissioned because we had a very high perinatal mortality rate compared to a lot of other DHBs in New Zealand. In that review, more than 50% of the babies who were born in Counties Manukau were to Pacific and Maori women, more likely to be stillborn or die during the neonatal period. Pacific women had a very high perinatal mortality rate. Jackson 2011 did a report here and identified obesity as a major associate factor for stillbirth for Pacific communities. In the same year, there was a meta-analysis by Thangaratnam in the UK, which showed that nutritional interventions in pregnancy were associated with reducing of pregnancy weight gain or excess pregnancy weight gain, and also reduced pregnancy complications, diabetes, hypertension, preeclampsia, etc. And there was a tendency to reduce also stillbirth. In that review, there was a strong recommendation. Urgent work needs to be undertaken to develop culturally appropriate nutritional intervention and lifestyle interventions to optimize weight gain during the pregnancy. In other words, that the women don't get excessive weight gain during pregnancy to improve outcomes. What did we know? We knew nothing about our women in Counties Manukau. We didn't know what they knew of their knowledge and beliefs about nutrition and physical activity during pregnancy. So huge gap, we needed to get some information. So we set out to to develop a survey to look at views on nutrition and physical activity in pregnancy, factors influencing eating habits, measured versus perceived body weight, and whether women were interested in participation in an intervention study or even an intervention in pregnancy. In clinics, we recruited women, got verbal consent, and we filled a questionnaire on an electronic tablet using SurveyMonkey. And if we ran into technical problems, then we resort to paper. And there's our research team. And we recruited women between September and December 2013. And that is our ethnic distribution of women that we recruited in this sample. As you can see, they're relatively representative of our women that birth here in Counties Manukau, the ethnic distribution. Average age was about 29 years, gestation about 29 weeks gestation. More than 80% had more than one child, and about 50% we weren't surprised. Most of them don't have a planned pregnancy. And you can see there in this women that we surveyed, as you can see, we have a very high rates of, in our Maori and Pacific populations compared for BMI of over 30 compared to our Asian and European. And we also, for us, we have more, For us, we have, more people in our homes, as compared for us, Maori and Pacific, compared to Asian and European in that cohort. What about self-reported healthy eating? A lot of us did report that we occasionally, or rare or never eat healthy as compared to our Asian and European. Interestingly, most of the women knew about healthy eating. Most of them have received information about healthy eating, and mostly from a trusted source, which is usually a midwife or a GP. And most of them have had information from the MOH, which is Eating for a Healthy Pregnant Woman during pregnancy. And for the ones who reported that they ate more, the commonest reasons for eating more was because I'm eating for two, And also because I'm craving, so therefore I'm justified, I should really eat more. What about takeaways? Most of them report that yes, it is a family treat. And most of them say, yes, it's convenient. Some of them say, quite a significant number say it's cheaper than their cooking. It tastes better. And for those who ate more than 3 takeaways a week, or takeaways more than 3 times a week, are usually the self-reporters non-healthy eaters. And more than 80% of the women agree that if you're overweight, underweight, gaining too much or too little weight, it may increase health problems both for the mother and the baby. We had a figure rating scale, so we measured the women's weight and height in the clinic when we saw them, and we asked them, which of these figures would represent your BMI? And most women underperceive their BMI. Only about 11% of obese women accurately identified their BMI. Some of them said they were underweight, 20% said, oh, we're normal weight, and 67%, oh, we're just only slightly overweight. Factors significantly associated with not eating healthy, as you can see from our ethnic groups. Obesity, if you have an unplanned pregnancy, if you have more children, or you eat takeaways more than 3 times a week. What about physical activity? It was interesting, most women knew about the acceptable level of physical activity in pregnancy, and 88% of them, the most common physical activity was walking. And about 81% of them said, we asked them, if we develop an intervention, would be interested in participating. This is more looking at the development of a study. And they said, 81% said yes. Also, we're interested about text messaging, talking about text messages. We wanted to know whether they had access to a mobile phone or to the internet, and a significant number of them said yes. Challenges to participation: if there's no one to look after their other children, not enough time, program not in the neighborhood, no transport, and women who don't think they have a problem. They preferred one-to-one rather than group settings. They prefer a clinic setting, one-to-one rather than community hall. Weekday, don't impose on our weekends. And so as a result of that, we've developed a randomized controlled trial. We've almost finished recruiting at the moment of pregnant women with BMI of over 30, nutritional versus routine advice. And then we re-randomized them again to probiotics or placebo, and we've almost finished recruiting. Hopefully we'll get the 230 by the end of this month. And the protocol for that's also been published in the BMC. So in conclusion, we do have an obesity epidemic, but you all know that. It's affecting especially our Pacific and Maori populations. From this survey, we've had really helpful information around beliefs and knowledge, physical activity and unhealthy eating. And women were willing to participate, and we've almost finished recruiting for our RCT. Just some acknowledgement. We really acknowledge the women that participated, our supervisors, counties, and all the support that we received. Thank you very much. And do you have any questions?